So the day of surgery, you'll show up. It will be early if you're one of my first patients. I also get up early every day. So the whole team's there for you. You will get checked in. You'll get an IV. You'll change out of your comfy clothes into a gown. My PA, Caleb, or I do have a fellowship, and so the fellow could come by as well. They'll help you fine tune any of the paperwork, sign the consent, site mark your leg. So it's important to identify right or left is the correct side. So patients like to joke, oh, it could be your left, or right is right. This mistakes happen. So it has not happened to me, but take that very seriously when we ask where we're operating, because that's where we put the initials and that's where the site of surgery will be. After that, make sure you get up to go to the bathroom, probably about 30 minutes or 45 minutes before your procedure. We don't use catheters or Foleys. Being a patient, I realize that's not a good patient experience if you don't have to have one. And so we don't use those. So go to the bathroom before. Nothing to eat or drink after midnight. However, there is a caveat to that rule, and that we give you a high electrolyte drink, and a Gatorade works 4 hours prior to procedure. That actually helps you stay hydrated, helps keep your sugar levels up a little bit, and has been found to decrease your swelling after surgery. So that is important to do. If you're waking up at 4 to come to a surgery at 5:30 for a drive, you don't need to wake up at midnight necessarily. Just drink the Gatorade before you go to bed. The day of surgery, then I come by, I see you, I ask if you have any other questions, talk to the family. I let the family know we're going to call them when the actual case starts and when I'm finishing up, because there's sometimes patients are back for 2 hours or 3 hours and wonder if something's going on because I told them about an hour. We'll let the family know when we start and when we finish. And sometimes that's longer for anesthesia, moving on and off the bed, prepping and draping. But the surgery time should be about an hour. Once you're in the OR, the anesthesiologist does what we call a spinal block. And so very similar to an epidural, where you'll be kind of numb from the waist down. That minimizes the amount of anesthetic you need. And in fact, you're breathing on your own during the case and given usually propofol, which if you've ever had a colonoscopy, it is very much when you wake up, you don't think we're even done because you just took a nice nap. When you wake up though, your legs won't be moving because of the spinal, and that takes anywhere from 2 to 3 hours to wear off. While you're there, family can come back and talk to you. And really that's what the next trigger is as far as discharging. So once the spinal wears off, you're able to move your feet, you're able to lift your leg. That prompts the nurse to call a therapist to say, the patient's ready to discharge and get evaluated. Let's say I do your hip or knee at 8 o'clock. Usually you're out of the OR by 9. You're usually in the recovery at 9 o'clock. By about noon is when you'll get evaluated by therapy. They'll usually get you something to eat. They'll get you up. You'll walk around. You'll do stairs up and down. If you've passed all your milestones, and the discharge criteria to home is your pain's well controlled, you're peeing, you're passing gas, and you're ambulating, and you feel safe, and you have a good discharge plan, you're able to go home the same day. And I would say 99% of joint replacements, hip and knee, are able to go home the same day. If you're a more complex pelvis procedure, PAO, revision, I like to keep patients at night just to see how all their blood pressure and things are doing. If you're older than the age of 80, we take a good hard look if you're able to discharge the same day. Otherwise, most patients are able to discharge the same day. You're able to recover in the comfort of your own home. If you've ever been in the hospital, you get woken up all the times with the beeps, the alarm's not working, the blood pressure guff going off. It's not a restful experience. I think it's better to rest and recover in your own home if that's safe. Pain control methods, that work really well and have this plan in place, distraction is one of the best things for pain control. If you're laying in a hospital bed with no one around and alarms around you, all you can think about is, I might be in some pain. If you get home, music, movies, friends, any type of distraction keeps your mind off of it, and it's been found that that's more powerful than taking any pain medication. So again, if we can get you safely to your own home, that is the most ideal location for you to recover. You're able to get better sleep than in the hospital, and we want to work towards a process to do that with you safely.